Hypercortisolism is also known as the Cushing syndrome. Now, it is a rare condition nowadays, but it can occur due to the high level of the cortisol in the body. The reason behind hypercortisolism can also be the high level of other glucocorticoids, but the main glucocorticoid that is responsible for the hypercortisolism is the cortisol. That is why the Cushing syndrome is also known as the hypercortisolism. Now, if we talk about more about the disease, it is due to the high level of the cortisol, and as I told you, that cortisol is released from the adrenal gland. Now, you can see here this high level of the cholesterol can be due to any reason, but the most common reason here is the external administration of the cortisol, that is the exogenous administration. Now, there are so many diseases in which glucocorticoids are used as a treatment option. So any person who is taking glucocorticoid for treatment purpose or for treating any other condition, he may or she may suffer from the hypercortisolism due to this external or exogenous intake. What happened mostly, the patient who are taking the glucocorticoids, their weight increases, they experience the weight gain, and this can be due to this reason, the high level of the glucocorticoid in the body, that will then have impact on the body weight, as they will activate the stress system of the body, and they will make the deposition of the fats into the visceral parts of the body. That basically actually leads to the weight gain. And also there is the increase in the appetite, that is due to the activation of the sympathetic system, the overuse of the glucose, and the cells feel like they are deprived of the energy, and they signal the brain to make eat more and more, and the patient feel hunger and appetite. That lead to overeating and the overweight as well. So these are some main symptoms. Other symptoms like the moon phases and the buffalo hump, they are also very common. So basically, it is the over secretion or overproduction of the cortisol inside the body that can be exogenous, or that can be other reason like the pituitary trauma, the hyperplastic conditions. There can be adrenal gland carcinoma as well that can lead to the Cushing syndrome.